Hey dolls, I'm very excited because today there is an influencer, a comedian, a hostess, an amazing actress, a great mother, and an awesome, amazing human being. I know her for over 10 years. We have Aly Sanchez here, and of course, Dr. Hunsaker. You all know the love that I have for him. And Aly just had a consultation with Dr. Hunsaker. And Doc, would you please tell our viewers what just happened and why Aly is here?
Well, Aly previously had breast implants, saline breast implants, and felt like they were much larger than really what she wanted. And so in the past, they deflated the implants, what we call percutaneously. They just inserted a needle through the skin and let the saline out. It deflated them. So the deflated implants are still in place, but there's no volume to them. So what she's done is she showed me a wish pic of the shape and proportion of the breasts that she'd like to have. And so with that as the guide, and then on examining and measuring her, we've determined and agreed that what she needs is a small breast lift to tighten up the skin envelope, make the breast perkier with the areolas in a better position and a better size, and then a very low profile, very small implant, just to sort of support the lift and maintain a tiny bit of upper pole fullness. You know, she wants something that's much smaller than what we normally see here, which is fine. But when people come in and ask for something that's much smaller than the normal range or larger than the normal range, we have a little longer discussion to make sure they're positive about their goals, which she is. And so that would just involve removing the deflated implants, placing these very low profile implants in their place, and doing the breast lift. Because when we perform the breast lift, we also actually remove some existing breast tissue, skin, and fat. So that also makes the natural breast even smaller that's in front of the implants.
Okay. Ahora para nuestros hispanohablantes, Aly, ¿podrías explicar exactamente por qué estás acá y qué es lo que quieres?
Bueno, realmente yo las tenía como en un 460 que era bastante grande.
Tenía salina.
Salina, agua salina, exacto. Entonces, al pasar por un embarazo y después pasar por otro, se me pusieron súper grandes. Entonces ya no me estaba gustando como me estaba viendo, porque yo no soy de vestirme como muy escotada ni nada. Y llegó un momento que ya dije, no, las quiero súper pequeñitas, porque me costaba también trabajo que cuando engordaba un poquito se me veían mucho más grandes. Y yo hago fotos, yo soy actriz y no me estaba gustando como el tamaño. Entonces me ponché el agua salina, el implante básicamente está adentro, para que recogiera un poco la piel, porque al crecer tanto, me salieron como estrías. Entonces por eso es que las quiero como pequeñitas, para que no me pase eso.
Ahora, cuando te inflaron el agua salina, ¿el cuerpo lo absorbió o lo quitaron para afuera?
Lo quitaron y quedó como un poquito, que eso el cuerpo después lo absorbía, pero lo quitaron. Lo quitaron, hicieron drenaje.
¿Tú tienes alguna pregunta para Dr. Hunsaker?
No, yo confío en él.
But she's saying that she really trusts him. Doctor, is there anything else you would like to add?
Well, I don't think so. I mean, she's a good candidate for the surgery. She knows what her goals are. She's communicated them very clearly. So I think we have a good plan.
That is great. In regards to recovery, is it different than a normal breast augmentation, because she is also going to get a lift?
Well, a lift is always different than just, a lift is much more invasive, you know. But it doesn't actually hurt more. The lift really doesn't. It's basically a skin and operation, and breast tissue itself doesn't have much in the way of sensation on the inside. So generally, if you do a breast lift alone, they don't have much pain, except maybe just the first day, because everybody's a little sore the first day.
Right.
When you add implants to it, their recovery, discomfort-wise, is basically from the implants.
Okay.
Now, she's having very small implants, so there isn't much pressure from that on the muscle. And she's already had a pocket created, and it may still pretty much be there. Sometimes it kind of gets sticky and sticks down when it's been deflated a while. But plenty of other times it's not, and it might just be slipping the old deflated ones out sliding the new one in there, and there's essentially no discomfort from that, and she would just have the soreness from the breast lift.
Okay. So, obviously, because of breastfeeding for some time, she has the bigger areolas. So, with the lift, would you be able to fix that as well?
Right, when we do breast lift surgery, we can keep the areola the same size or make it any amount smaller. We can't make it bigger. And we actually use little devices that they're called cookie cutters because that's exactly what they look like. They're just round metallic things that have different diameters. And it doesn't change anything about the operation other than which cookie cutter do we use to mark it.
She mentioned, and she's very popular on Instagram, and she always talks about her personal life. She mentioned that in the future she would like to have more kids.
Yeah.
How will it affect her surgery, or will she be able to breastfeed again? And is it normal that women get that in between pregnancies?
Well, it would be common, okay, that people do it, whenever they decide. I mean, pregnancies aren't always, happen when you necessarily plan them to. Both ways, you want to and you don't, or you don't want to and it does. And breastfeeding.
Yeah.
There's always a risk of an interference with breastfeeding, the potential for breastfeeding, and there's always a risk of a change, a permanent change or a temporary change, or even a loss of nipple sensation. In her case, the amount of lifting that needs to be done, the amount of movement and dissection in the tissue is much less than average. So it's the risk of her having an issue with future breastfeeding is less. But it absolutely is a possibility that it could interfere with the ability to successfully breastfeed.
Doc, one last question, and I love touching this subject with you because you changed my view of breast augmentation, and that's one of the reasons why I got mine done with you. So Aly, after having the big implants, she really wants something smaller and natural looking, and you again suggested the low profile implants. Can you break down one more time to us what a low profile is and like the difference?
Yeah, it's pretty easy to use as an example. We have a number of different profiles: low, low plus, moderate, full, and ultra full. Okay? So I did measurements on her, and I determined that for her goals we would need an implant that was 10.5 centimeters wide to fit in her breast the way she wants them. So in each one of those profiles there's an implant that is either at or very close to 10.5 centimeters wide. So if we set them all in a line on a table, they're all the same donut size, okay? But the low profile only rises 2.1 centimeters, the low plus 2.5 centimeters, the moderate higher, the full higher, and the ultra full higher. In her case, because of her goals and the amount of existing tissue she has and all that, I'm using a very small, low profile implant. That's a lower profile than yours. 140 cc's.
Okay.
Now remember, she started at 400 and something.
For 60, right? You said
Yeah.
for 60, yeah.
But it's pretty clear from her wish pics and her goals that's really all she needs to just provide that little bit of support and upper fullness to a very small degree that she desires on her frame.
Tengo una duda.
Sí.
¿Qué tiempo cuando te haces los senos, qué tiempo debes esperar como hasta que, por ejemplo, para salir embarazada?
So after she gets her breast done with you, with the lift and everything, how long should she wait to get pregnant?
Yeah. It actually probably doesn't really matter much. I mean, most people aren't going to be engaging and trying to for a little while right after the surgery. And then just because you become pregnant doesn't mean your breasts change yet. So she's well healed before there's any changes going on with her breasts.
Dice que después de hacerte la cirugía que no vas a querer hacer nada relacionado con tener niños por un tiempo, por un par de semanas o más. About a couple weeks or so, she wouldn't be able to have sex, you would say, or more?
Well, normally we ask people not to
sexo.
engage in sexual activity for at least 2 weeks. And it's just because I say this all the time, but no heavy lifting, pushing, pulling, strenuous activity, cardio, or aerobics. If you're going to have sex, it might as well be good sex, and it's going to involve at least one of those things.
Right. Cardio, hopefully.
So most people, at least several weeks to.
No sex, no sex. Lo que me refiero es literal porque a mí me tienen planificado un in vitro para buscar el varón. Lo que quiero saber es que cuándo le puedo decir al médico, a partir de tal tiempo es que podemos...
So what she's trying to explain is that, and I'm sorry we're both laughing. I didn't mean she's saying that she's going to do in vitro. So, how long after she would be able to go to her fertility doctor and say that.
Just pretend that's the sex.
Yeah.
Right?
Pretende que ese es el sexo.
I mean, it doesn't really matter how the pregnancy occurs.
Right.
But, I mean, it's a little different because you've got to be ready to accept and all that sort of thing. So, I mean, you're probably going to wait a couple of months at least before you think about that.
Okay. 1 year.
However long you want.
Doc, thank you so much.
My
Ali,
pleasure.
muchísimas gracias. By the way, Dr. Hunsaker speaks Spanish too.
Oui, oui. Oh,